Hello, welcome back to Homeopathy discussion series. Today we are discussing a few questions from previous question papers. See the first question. Clubbing of fingers is caused by all except cyanotic heart diseases, ulcerative colitis, Crohn's disease, and biliary cirrhosis. The correct answer is cyanotic heart diseases. Then what is clubbing? Clubbing is the changes in the areas under and around the toenails and fingernails that occurs with some disorders. The nails also shows some change. Clubbing is the changes in the areas under and around the toenails and fingernails that occur with some disorders. Clubbing can develop quickly, often within weeks. Then, what are the common symptoms of clubbing? The common symptoms of clubbing are soft nail. The nails may seem to float instead of being firmly attached. The nails form a sharper angle with the cuticle. The last part of the finger may appear large or bulging. It may also warm and red. And next, the nail curves downwards, so it looks like the round part of an upside down spoon. Clubbing is not found in cyanotic heart diseases. We can broadly classify the heart diseases into two, that is cyanotic heart disease and acyanotic heart disease. As you know, cyanotic heart diseases are not associated with the condition cyanosis. Then, what are the main cyanotic heart disease? Ventricular septal defect, atrial septal defect, atrioventricular septal defect, patent ductus arteriosus, aortic stenosis, pulmonary valve stenosis, coarctation of aorta. These are not associated with cyanosis. Now, what are the examples of cyanotic heart diseases? Tetralogy of Fallot, tricuspid atresia, other univentricular heart with pulmonary stenosis, transposition of great arteries, total anomalous pulmonary venous return. The cyanotic heart diseases are associated with clubbing of fingers. Then what is the exact cause of the clubbing of fingers? The exact cause of clubbing is not clear, but it happens when certain substances in blood, one of those is vascular endothelial growth factor or VEGF, vascular endothelial growth factor. Vascular endothelial growth factor is formed more when the tissue can't get enough oxygen. As a result, more blood vessels will be grow. This may change the structure of fingers. Another possible reason for clubbing of finger is the focal stimuli for finger clubbing include mucosal inflammatory change and fibrosis mediated by the vagus and possibly other autonomic pathways acting as the afferent arc of finger clubbing reflex. That's why clubbing is also common in Crohn's disease and ulcerative colitis. We can broadly classify the diseases which are causing clubbing under three categories. 1. Heart diseases, 2. Lung diseases, and 3. GIT disorders. Cardiopulmonary disorders includes severe chronic cyanosis, congenital cyanotic heart diseases such as Fallot's tetralogy, chronic fibrosing alveolitis, emphysema, cystic fibrosis, chronic suppression of lungs, bronchiectasis. empyema, carcinoma of bronchus, pulmonary tuberculosis, mesothelioma. Under GIT disorders, Crohn's diseases, polyposis of colon, ulcerative colitis, biliary cirrhosis. What is ulcerative colitis? Ulcerative colitis is an inflammatory bowel disorder that causes inflammation and ulcers in digestive tract. Ulcerative colitis affects the innermost lining of large intestine. Ulcerative colitis affects the innermost lining of large intestine. Crohn's disease is also a type of inflammatory bowel disease. But in Crohn's disease, there are healthy parts of the intestine mixed in between inflamed areas. In Crohn's disease, the healthy parts of the intestine mixed with inflamed areas. In ulcerative colitis, on the other hand, it is continuous inflammation of the colon. Ulcerative colitis only affects the innermost lining of the colon, while Crohn's disease can occur in all layers of the bowel walls. Ulcerative colitis only affects the innermost lining, but Crohn's disease can occur in all the layers of the colon. Biliary cirrhosis is now called as biliary cholangitis. Biliary cirrhosis is the old term for biliary cholangitis. It is a chronic disease in which the bile ducts are slowly destroyed. The bile ducts are slowly destroyed in primary biliary cholangitis. In most of the cases, the patient do not have any noticeable symptoms when diagnosed. But in later stages, the symptoms may include dryness of mouth and eyes, pain in the upper right abdomen, swelling of spleen, swollen feet and ankle, yellowing of the skin and eyes, darkening of the skin, weak and irritable bones which can lead to fractures, high cholesterol, diarrhea that may include grey stool, underactive thyroid, weight loss, etc. We just discussed what is clubbing, what are the causes of clubbing, what is cyanosis, what is ulcerative colitis, Crohn's disease, and biliary cholangitis, etc. Now let's go through few remedies. Lorocirrhosis is extremities clubbing of fingers. Apocynon, tricuspid regurgitation, rapid and feeble irregular cardiac action, low arterial tension, pulsating jugulars, general cyanosis and general dropsy. General cyanosis associated with general dropsy. Digitalis, lachesis. In lachesis, palpitation with fainting spells, especially during climactics. Constricted feeling causing palpitation with anxiety. Cyanosis, irregular beats. Next is lorocirrhosis. Cyanosis and dyspnea worse while sitting up. Patient put hands on heart. Cough with valvular disease. Exercise causes pain around heart. And also mitral regurgitation, clutching at heart and palpitation. Cyanosis neonatorum. See, cyanosis neonatorum, the remedy is lorocirrhosis. Next is hydrocynicum. Cyanosis, collapse due to some pulmonary condition, not a cardiac collapse. In hydrocynicum, the collapse is due to pulmonary condition, not due to cardiac collapse. So we briefly discussed the condition clubbing and the associated factors, remedies, main remedies associated with clubbing, cyanosis, etc. And thank you all.